As amazing a tool as the internet can be, I can't help but be cautious of a lot of what I see on the internet. I can't help but be skeptical by the things I read. However, because of my skepticism, I find myself doing a lot of research for the truth. Now, I've been doing this ever since the Obama election. Don't worry, this isn't a political piece. This is for information. You see, recently I received a message on Facebook Messenger, and it really caused me some concern. Now, I've seen this message in the past. It's popped up before, and I've just ignored it. However, when I noticed this message pop up again, I couldn't help but say something about it. So here it goes. Are you ready? A cough will not stop a heart attack if you are alone. Okay, you might have seen these come across your Facebook Messenger pop up saying, if you're alone and experiencing chest pain, cough, it could prevent a heart attack. Well, that's not true. I've been in the medical field for quite a number of years. I was a hospital corpsman in the Navy. I taught EMT school for first responders. I worked in the Naval Hospital's education department where I worked as a basic life support instructor trainer, as well as an advanced cardiac life support instructor trainer. Now, when I got out of the Navy, I kept teaching at post-secondary schools where I taught, among many topics, anatomy and physiology and medical terminology. I've worked in emergency rooms and ICUs with many doctors and nurses over the years, so I feel comfortable enough in telling you coughing will not stop a heart attack. Now, sometimes doctors will ask their patient to cough if they notice an arrhythmia on the monitor, or if they notice the patient is about to go unconscious. However, if you're home alone and experiencing a heart attack, rather than coughing, you should dial 911 and get emergency intervention for that heart attack. Now, coughing during a heart attack can help to move some blood to the brain, which may help in keeping a victim conscious during a heart attack. However, the message being delivered to people on the internet is misleading, as it suggests coughing will prevent a heart attack. Now, according to the American Heart Association, the best treatment for a heart attack is early medical intervention. Now, since I work with plenty of doctors and nurses, I asked them about the self-CPR cough, and not one of them would agree with any such thing. Therefore, I did some research and I found an article by Dr. Keith Roach in the Herald Review that will fully explain the cough during CPR, and you can find the link below. Now, I don't blame anyone for wanting to help their fellow man by passing along helpful information, but when it comes to finding medical information on the internet, do a little research before passing along any such information. There are a lot of gullible people out there, and passing along such information could actually do more harm than good. When I was a first responder, we had a saying about someone who was medically misinformed. We would say, they know just enough to be dangerous. Such is the case with people who seek medical information on the internet. They'll get just enough information to think they know what they are doing, but the outcome would be devastating. Please know, this isn't being told to you to be mean. I commend anyone who cares enough to spread helpful information. The issue I have is that most of the information being spread on the internet is not as helpful as it should be. If you're truly concerned with someone's cardiac health, learn CPR. You'll do more good when you actually have to use it. I'm Stitch Mainville, and that's my 2 cents.